We start tonight in Crawford County, where it is the first day of the second annual Drug Diversion in Healthcare Conference. This is hosted by the University of Pittsburgh at Titusville. There's been organizations and workers within healthcare that are coming together to fight the issue of drug diversion. Tonight, our Caleb Yager is joining us in the studio. Caleb, you were there earlier today. What are some of the big issues that are being addressed, and what are some solutions that the folks there are helping to find?
Yeah, good evening, Eva. Let's start by asking the question, what is drug diversion? According to the U.S. Department of Health and Human Services, drug diversion is the illegal distribution or abuse of prescription drugs or their use for purposes not intended by the prescriber. It's also an issue across the healthcare field as a whole, and several entities are coming together to fight it.
There's a huge intersection.
An auditorium full of people who are on the same mission.
See something, say something. And that goes a long way.
One of those people is Matt Wise from ScriptSafe. Wise says that 15% of people who work in the healthcare field are diverting drugs, a big topic of discussion at the second annual Drug Diversion in Healthcare Conference at Pitt Titusville.
The pain points that are in the healthcare industry, we all want to come around and solve.
Wise presenting his solution with a safe, requiring individual key codes, hoping to limit temptation for those who may fall victim to it.
Temptation with security and barriers put around it really does drive down diversions.
And the drug crisis that we're facing.
In her decades of nursing and mental health experience, Dr. Susan Maloney from Penn West Edinburgh shares her thoughts with attendees, emphasizing that substance abuse disorders are some of the main reasons for drug divergence.
Substance use disorder can encompass alcohol misuse, prescribed opioid misuse, methamphetamine, coke, crack cocaine, any illicit drug.
Both Wise and Maloney expressing the most important way of solving the issue, a journey to recovery.
We don't want to see them get fired, right? We don't want to see them go and, quietly go somewhere else and keep that diversion problem going.
Every single person has a story, and they have a story that'll bring you to your knees if you're willing to hear it. And we really have to meet people with empathy and compassion.
Another big topic was the discussion of AI. Hospitals are now trying to implement more and more technology that can audit more activity. And the ultimate goal is to try to get people to think twice about even starting to divert drugs. Live in the studio, Caleb Yager, Erie News Now.